first of all, I want to tell you,
Yeah.
when I was doing my research last time on trying to, find out stem cell places, and I loved that you were so transparent and no pressure, which I didn't realize until a friend of mine was doing some research again. I was like, oh, I remember people that I had called, were calling me the next day and sending me multiple emails. Are you ready? Have you decided? And I was like, I think I'm still doing research. So, and when I spoke to you on the phone, it was just this lovely, conversation but it really was. I felt so comfortable. I never felt pressure. And you were just like, hey,
thank you.
check the website out, which I had done already, but you were just like, let us know if we can help. And it's been a really big deal. So I have Sjogren's disease, and I have Sjogren's as a primary, which most people usually have it as a secondary.
Yeah.
So that's why I have so much of the dryness, which my voice will start to get hoarse here in a few minutes, even though I have a mint in, but because I can't usually talk for more than a couple minutes without it getting really dry.
Got it.
But so after my last treatment, probably about the 2-month mark or so is when I noticed like my eye had some moisture in it, which was a huge deal. I know people take it for granted because you don't know until you don't have, when your eye starts sticking to the back of your eyelid, you have multiple, lesions and all these other things that start to occur. You can't be in bright light, and I have these special sunglasses that have these capsules around them, so they're moisture chamber sunglasses. Then I started getting moisture in my mouth, which was a really big deal as well, because you have to drink hot liquid with all of your food. You get tons of cavities, even though I eat really well. Remember, I was telling you, I think the year before I spent easily, I think $15,000 just on dental work, because when things are imbalanced, you don't have that. Your mouth just can't provide the moisture. My CAT scans that I used to get on my lungs every 6 months, I'm now getting just once a year.
Okay.
So that was a big deal. And then there's a couple other things I was so excited to tell you about. So when I had my last stem cell here, it was right about Halloween, I think, for me, easy to remember. And I get my teeth cleaned every 3 to 4 months. And they do that little prong where they poke down to see your gums and how much they've receded. Because when your mouth is really dry, your gums actually kind of flare out, which is very painful as well. But so we were doing that, and she was saying 1 and 2, which is such amazing results. Even just people on a regular basis usually don't have 1s or 2s. They're usually 3s for the pocket of how many millimeters. So she was so excited for me, and we definitely had a big celebration there.
Cool.
Yeah, and then the CAT scan, a few of my darker spots inside of my CAT scans went away.
Wow.
So that was a big deal.
Wow.
Yeah, so there's been some great progress. And then I'm back because it's about the 8-month mark. Just a few weeks ago when I called you, and kind of not a panic, but I was like, do you have any openings? Because I didn't realize how quickly my symptoms were going to come back.
Got it.
And so here I am. And the other thing I wanted to let you know about was I get my blood work done every probably 4 months from my rheumatologist. And so I get to see at the place I get my blood work done, you can click on a graph because I've had so much done, and you can see how it's done. And so in my ANA and Sjogren's, I am SSB positive and SSA positive. Sjogren's people will understand this, but I know Josh knows a ton about stuff. But So I'm double positive for that. And my last blood panel that I had 3 months ago, my SSB was gone.
Wow.
So I'm still SSA, which, but to have one of those gone was
We're seeing
amazing.
improvement. I mean,
Yeah,
that's
and a
awesome.
lot of my other panels that are usually up in the red dipped down quite a bit after my last treatment. So it was, a big success. And I am
So cool.
thrilled because all of my other doctors and even at UCSF, it's really challenging because there is no treatment.
So at USF, you're saying you're usually going to like the university hospital and talking
I
with them.
did for some, they wanted to have me be part of a study, but and this was pre stem cell treatment, only by like 2 weeks. Cause when they got me and I was like, cause I probably couldn't have done this study, but they just wanted my data. So they did a lip biopsy, which is where they take, that's where your salivary glands are part of it. And so they take about 10 pieces of that, and then eye stuff and tons of blood work.
Wow.
And I saw an ophthalmologist, a rheumatologist, and a Sjogren's oral specialist. So she does specifically for your oral cavities. But yeah, my rheumatologist has been really happy with my blood results, and
Well, how long have you, when did you first notice symptoms with Sjogren's?
Probably about, in hindsight, probably about 8 years ago. But because I'm 55 now, so I was going through menopause, and I had also had LASIK 20-something years ago. So first of all, it's your eyes get dry. And my ophthalmologist said, well, you've had LASIK. And a lot of people have dry eyes.
Yeah.
And I don't work on computers, so it's not like I'm constantly staring at a screen.
Okay.
But so they just chalk it up to, you've had LASIK. And then these other symptoms of things they kind of chalk up to menopause.
Got it.
And so you kind of get, it's a frustrating journey, for sure, trying to figure out. And it usually, even in the research, they tell you it takes about 5 years to get diagnosed with Sjogren's, because by the time it's so bad, then they can tell what it is. But back when they're trying other things, it's just difficult to figure out what is going on, because it could be other things. But when you put all of them together, because Sjogren's is any moisture gland that you have in your body is compromised.
Yeah, it's just not functioning properly, right?
Correct. Yeah.
It's like the immune system's attacking that area and just shutting it down. So, okay, we do treatment, all that, but you said around 8 months after.
Yeah.
So were symptoms returning, or what was happening?
Actually, really rapidly.
Really?
And the other part that you just don't know about, right? It was all of a sudden this crazy hot week at our house. The wind was blowing like crazy. So it was 40-mile-an-hour and 90 degrees. And we have about 20% humidity. So I'm like, oh, well, it's got to be that. And it's also pollen season. So all of these things were happening that if I was in a sterile environment like this, it would be totally different.
Yeah.
And so I thought it was that. And then these other things, like some of the neuropathy in my leg, which is also another symptom, has started to come back.
Got it.
And then the severe dry at night. And I have 2 humidifiers running in my room, but it gets so dry that your throat actually feels like it gets stuck closed.
Oh, wow.
A lot of us have our mouth taped at night for Sjogren's to make sure you're not mouth breathing.
Got it.
So instead of just waiting and going, gosh, is this, but then I just had blood work done. I can't remember the exact date, but my numbers had started to shoot back up a little bit. So I thought, okay, this, at least I felt validated that it wasn't
it's
just
not
allergies.
in your head or whatnot. Yeah.
Yeah. But on a side note, we're actually moving to a different state that has more humidity, which is a really big deal.
Yeah, not the most humidity up in San Francisco.
Well, yeah, and I live north
of
there, and I live in the mountains where we get snow, but it's really dry in the summer.
Yeah.
So that's how like life impacting, this can be, is that you're changing a location.
Even environment.
Yeah.
And everything. 'Cause I mean, I got lots of family in Northern California. I lived out there when I was younger. It's beyond beautiful, but it's dry.
It's really dry.
Yeah, that makes it rough.
Yeah.
Well, interesting. So now we're doing another IV.
Yes.
And do the facial tomorrow. We're gonna get hopefully get everything turned back and good to go.
Yeah. Thank you so much
No.
for everything you've done. And
No, thank you for sharing. I mean, just to help other people who are dealing with that. I mean, what else do you do, right?
Right. And your videos have helped, even though some of the symptoms might not be what I had, but to see people's results and that real time, it wasn't that it was 8 years ago, and that's okay if it was for people, but that current videos I think are really important.
Yeah. No, it really does matter, more current. And also, I mean, we told you up front, like, we have great success with autoimmune diseases, but we haven't had really anyone else with Sjogren.
Right.
So it's, we're never going to make promises like, oh yeah, it's autoimmune,
No,
we'll fix it.
You were so honest about it.
You see certain things like type 1 diabetes, right? On paper, autoimmune disease, it should be a no-brainer. It should fix, but it just doesn't really make a big difference for type 1, but for type 2, it's worked for tons of people. So, there's a huge list of autoimmune diseases out there, right? So
massive list.
We have a very high success rate. We've got on the site the ones that we've seen the best results, but we may add some in the future depending on what we treat and stuff. And we'll probably put up a Sjogren's treatment now so people can see that and like, hey, this is something that's worked. Hopefully the second time will be long lasting. But I mean, look, you got 8 good months out of that. And
which is a really big deal. And you were the one who also had recommended that I did the facial one so we could get closer to my salivary glands, and that my eyes, all of that. I wouldn't want to do just the IV without it to see what the difference is, but that customizing suggestion was really great.
Yeah, we want to get it right to the area. We did the same thing with Hashimoto's. We were having success with the IV, but I finally thought, hey, can we go direct? And sure enough, we
can. If you could inject into my eyeball, I'd be stoked.
Did you see the new treatment?
I did, but it's not for dry. If you did dry eye treatment, you would have a line of people out your door that would be, begging to get in. But
it was. I went to Freedom Fest 2 years ago, and I got to go to a lunch with. Remember Ben Stein? He's like, if you've got dry, itchy eyes.
Yes, I do.
I was like, hey, Ben, really please. But no, that's really great. I'm so happy it's working good, and we hope to, in this, it'll give more people data,
Yeah, and so are all my loved ones, by the way. Yeah, they are. 'Cause it's scary, especially with. You can get interstitial lung disease from Sjogren's as a primary. So that's why I get the CAT scans. And that's why I'm doing the nebulizer tomorrow.
Well, and that's why it's so important those spots are gone, right?
Yeah.
Like you said. So that's
breathing
huge.
is an issue. So.
Okay, so a lot of moving parts with
that one. I know.
Jeez.
You wouldn't, if you've never even heard of it, you would never just go dry mouth, dry, big deal.
It's not. Whatever, right? Drink some water.
It's
like, a little more than that. Eye drops and water aren't going to fix it. And
it's like putting water on a dried sponge too. You know how the sponge won't absorb right away? It's like that. Yeah, it's probably a good analogy.
Interesting. Cool. Well, thank you so much for sharing. We'll finish up treatment here. And if you at home want to learn more about how we can treat Sjogren's disease, other autoimmune diseases, joints, things with stem cells, you can get a hold of us at www.dreambody.clinic. You can call us toll free at 833-445-9089. Free consultation. I'm Josh. Happy to help.